Hi, my name is Farrah. Today I'm going to be doing my blood glucose and insulin checkoffs. So before going to my patient's room, I'm going to make sure I have the correct doctor's orders. I'm going to check that and then gather my equipment. So I have my machine, my strips, my cotton balls, and my alcohol swabs. I'm going to go into the room, perform hand hygiene, and put on my gloves. As I'm doing that, I'm going to ask Mr. Miles, hey, will you wash your hands for me, please? I'm going to identify my patient and ask him name, date of birth. Once I do that, I'm going to set up my machine to make sure it's turned on, apply my strip, and then set that there for a moment. And then I'm going to ask him, hey, Mr. Miles, which finger do you prefer? He said his thumb. So I'm going to do his thumb, do the lateral side and the inside, not the dead middle of the finger, but just the side. I'm going to rub it and then get my lancet close by, get an alcohol swab, circular motion, apply some friction. And then Mr. Mouse, it's going to be a little stick here. Boom. Once I get that first drop of blood, I'm going to wipe it with a cotton ball. And then gently squeeze. Once I get the next drop of blood, apply the strip. And then set that there. Apply pressure. It should, low power mode. Okay. And so apply pressure there, and then if he's still bleeding, I could put a band-aid, but he's good. So I'm going to remove these gloves. And I see on my machine here, it's 252. So with this glove, I'm going to remove the strip with the blood on it, put in the biohazard, and sanitize the machine. And then I'm going to perform hand hygiene and go document 252 in the chart. So I know that the blood glucose is 252. I'm going to go look in the chart and see what the doctor has ordered for Mr. Mouse here for when his blood glucose is 252. So I'm going to go check the chart and look at the MAR, make sure everything's matching up here. And I see that my doctor's orders are regular insulin 6 units and NPH insulin 16 units. So I know that, so I'm going to pull my vials and get my needle, and then I'm going to check again and make sure my vials match my MAR. So I have NPH and regular. So now I'm going to perform hand hygiene, and I am back in the room at this point. So perform hand hygiene, identify patient again. And I'm going to roll my insulins. Make sure they're mixed up real well. Okay. So once they're rolled, I am going to clean the top of the vials with an alcohol swab. And I'm going to start with my NPH. So I'm going to pull up 16 units of air. And then inject the air, come straight back out, and pull up 6 units of regular insulin. Go in, push the air, and then immediately flip it. Pull back my 6 units, ensuring that there's no bubbles. Okay. And then go straight back in the NPH and pull up my 16 units. So in total, I'll have 22. Okay. So then I am going to recap this here. Okay. And then have another nurse check this. So when another nurse checks it, she will then sign on the computer that sign her name, ensuring that she checked it and I had the right amount. And when I give it to her for her to check, then I'm not going to tell her a number, how much it's supposed to be. I'm just gonna let her do that. And since I just touched my face, I would remove these gloves and perform hand hygiene and put on a new set of gloves just to make sure everything stays clean here. So there's that. So next, I have my insulin drew. My nurse checked it. I'm gonna do my third check. Hey, Mr. Mouse, can you tell me your name and date of birth? Ensure everything is right on the MAR. My insulins are good. All right, where'd you get your last stick? He told me he got his last stick in the left lower abdomen. So I'm going to do the back of the left arm. So I'm doing it right here. And so when I'm doing this, I'm going to pinch it. If I can get 1 inch, then I go in at 45 degrees. If I can get 2 inches, I go in at 90 degrees. So with Mr. Mouse here, I got 2 inches. So I'm gonna circular motion, and I'm gonna go in at 90 degrees since I got 2 inches. Boom. Insert the insulin. Okay. Apply an alcohol pad. Lightly, don't press, just lightly put it on there. And then I'll set them back up here. And then once I do that, I'm gonna get rid of my needle and the biohazard. And then once I get rid of that, I am going to remove my gloves. Put my gloves over here. And then wash my hands, and then I'm gonna document. So once I document, I'm gonna document where I did the insulin injection, how much of each insulin. Like I said, the nurse who checked me, she'll sign off when she does it, so that will already be in there. And then I'm also gonna document if there was any bruising on the other side, so you can do it in each of the lower abdomens, back of the arms, and I did it in the left arm. So if it was good, not a lot of bruising and everything, put that there. And that's about it. So once you document, you've completed it, and it's final.